Hi everyone, and welcome back to Dr. Coco's Medmonics. Today I'm going to be going over gallbladder pathology. And so today I'm actually really excited. I'm going to use this pointer because this is a picture that I hand drew, so I'm sorry if my handwriting is not the best, but I'm also not an artist, so give me a little bit of a break. But this has 5 different gallbladder pathologies that I found really hard to go through on first aid, because I would read it, I'd say, oh, I'd understand it, and then I would see a question on UWorld and I guess I didn't understand it. And I think a lot of the problem is that you take these different concepts and they put them in chunks and they talk about them as if this isn't even the same organ system. And so when you put these different pathologies all together in one picture, I think it starts to make a little bit more sense. And so the way I'm going to go over this, I have a letter A, letter B, and letter C. So we're going down the alphabet to kind of figure out which pathology we're talking about as far as gallbladder. Is it a stone? Where is it at? And what are we going to see in lab results or at this patient's presentation? And so we have the right hepatic, left hepatic. This is the common hepatic duct, common bile duct, and then the cystic duct going into the gallbladder. The A in this alphabetical little mnemonic is going to be for acute cholecystitis, and this is just like inflammation of the gallbladder right here. So you have a stone, it's causing gallbladder inflammation, and you're going to have an increase in ALP if the duct itself is involved. And the way you would diagnose this is you would do a HIDA scan. So if you have a question stem and it talks about, patient with acute cholecystitis, how would you diagnose it? You use a HIDA scan for this one, versus later on we would use an ultrasound. So 90% of cases have a stone that blocks this duct, and that's what causes the patient to come in with complaining of some type of discomfort. Next, when we go down the cystic duct, we're going to have biliary colic. And this is going to be when you have a stone here, but then you see these arrows. So this is when the cystic duct is contracting on a stone. And so that's going to cause a lot of pain, but this is going to be episodic because the patient has this contraction going on. It's not going to be all of the time. They're going to say, I have this pain maybe like right after a fatty meal or something. And we know that fat is going to be a key thing for CCK to come in and contract your gallbladder. And so then you have this contraction on a stone causing pain. So this would be the B for biliary colic. And when we're looking at biliary colic, we would diagnose with an ultrasound. And then the C coming down here is going to be for choledocholelithiasis. Sorry, that's a hard one. And this is going to be when you have a stone that's blocking the common bile duct, or anything that's pretty much extrahepatic, so outside of the liver. And this one, you're going to have these increase in ALP, GGT, direct bilirubin, and then your liver function enzymes, so AST and ALT. And that makes perfect sense, right? Because A and B over here, we're just talking about the gallbladder and the cystic duct. But when we come down here, when you block this common bile duct, you're also blocking things that are coming up here from the liver. And so then you're going to have these increase in liver enzyme tests, right? That makes perfect sense. So A, B, and then C. Something that I see a lot is you'll have this ALP test, and they're pretty much either talking about something over here in the gallbladder, or they're talking about bone. And so you're like, okay, well, how do I know? Like, does this patient have a gallbladder problem, or do they have like Paget's disease? I don't know. So then you look for this GGT, and that's going to determine if this is like a liver or a biliary disease. If they have an increase in GGT, that means that it's over here in your liver or biliary duct. Versus if they have an increased ALP, but there's a normal GGT, that's going to show that it's like a bone issue. This down here is a gallbladder ileus, and this is when your gallbladder decides to just make itself a little home and connect to the ileocecal valve, or not the ileocecal valve, the duodenum. And then you have a gallstone that would flow from the gallbladder through the duodenum and obstruct your ileocecal valve, because that's like the most narrow part. And how do you know if it's a stone that's gone all the way down to that valve, or do you know if it's a stone up here? Well, a key finding that you'll have is you'll have air in the biliary tree. And that makes sense because in your duodenum, in your whole GI tract, you're going to have air, right? That's what makes farts. So you have air in this tract that would come up into this biliary tree. Whereas before, you really shouldn't have a bunch of gas. This is stones, this is bile, this isn't gas. We don't fart from our bile duct. So you shouldn't have any air up here. And if you do, that's because there is some type of ileus connecting that GI system to your biliary system. The last one I want to talk about is biliary atresia. This is more of an embryological issue where you are not making something. And the key here is they'll have a baby, and it won't be right after birth. It'll be about 2 weeks later, and they will have dark urine and pale clay poop. And that's because the bile is what gives the color to your feces. So if you don't have that bile to make that color, it's just going to be pale. And it could literally be anywhere along this tract, anywhere along the extrahepatic bile duct, causing an obstruction. So atresia literally means you didn't make it, right? So it makes sense that if you didn't make any part of the system, you're not going to have bile going into your GI. And then you're going to have an increase your bilirubin and GGT, because we have this backup where bile is being made in the liver. Maybe it's being stored in this gallbladder, but it can't get out. So those labs will be high. And yeah, I hope this helps. If you can remember A for acute cholecystitis, B for biliary colic, and then C for the cholelithiasis, maybe this will help you figure out where in fact the stone is, what the problem is, and putting it all into a good little file in your brain. If you like this video, please like and subscribe to my channel.